Lung cancer diagnosis is never easy. I'm joined here today with Dr. Robert McGead, who is a thoracic surgeon at CU Medicine. Today, we are discussing lung cancer surgery, what it involves, what patients can expect before, the day of, during surgery, and recovery. Dr. McGead, when a patient first learns that surgery is recommended, what are the most important things they should know, and how do you guide patients through that process?
We are fortunate to have an outstanding multidisciplinary team dedicated to treatment of cancers, including lung cancer. And we want patients to know that they're not alone in this journey. In addition to all the other people who've been dealing with this disease, we have a team that's dedicated to improving their quality of life and helping them through this journey, so it's not reinventing the wheel every time, and so that they have a resource to rely upon to help them navigate this difficult situation and tough time in their life. When patients see me for lung cancer, we start with a clinic visit where I'm reviewing the patient's issues, learning more about them and their lung cancer, and helping develop a tailored plan to help treat their lung cancer with the aim of curing their lung cancer. The journey after clinic moves on to the operating room. Patients come in the morning, they have their operation, they're fully asleep during the operation. At the end of surgery, we wake them up, get them to the recovery room. A couple hours later, they move from the recovery room up to their private room in our recovery ward, which is dedicated to patients with having thoracic surgery. Patients' family members can see them in the recovery room and then can stay with them up on the inpatient ward where they're recovering. One of the most critical aspects of patient recovery after lung surgery is taking deep breaths and walking. And we need to make sure patients have excellent pain control so that they can be up and walking and moving around and taking deep breaths. Most patients who have lung surgery are in the hospital somewhere between 1 and 3 days, sometimes a little longer, as they recover from their lung surgery, as we get them ready to be home and be independent when they go home. And typically, once they go home, it takes somewhere between 2 and 6 weeks to feel almost back to normal, but it can take up to 3 months to get back to normal. And throughout that process, we're seeing them back in clinic, finding out how they're doing, calling them to get checkups on how their progress is going, and we're available to talk with them anytime they have an issue they're concerned about during their recovery.